Doctors and advocacy groups across Ontario are blasting the Ford government for quietly unveiling plans to cancel a pandemic program that offered healthcare services for people without health insurance. That program is expected to end tomorrow. Dr. Naheed Dosani with the Healthcare for All Coalition is joining us live now with more on the program and why so many believe that it should continue. Thank you so much for coming in and joining us this morning.
Thanks for having me on the show.
We start off with some of the work that the coalition has been doing over the last few months, suspecting that this program could be coming to an end since the province did put it into play to help during the pandemic and make sure that everyone felt safe going to get healthcare services. What was your reaction when you found out that this was being cut?
Yeah, so the Healthcare for All Coalition is a group of concerned health workers, organizations, and concerned citizens who are really, fighting to support healthcare for uninsured people. And what happened in 2020 was the Ontario government did the right thing. They put a policy into play to provide healthcare for uninsured people, our society's most vulnerable people. Last Friday, we learned that that program is being cut, as of tomorrow, actually. Make no mistake, these cuts to healthcare for uninsured people will have devastating impacts. People will get sick, and people will die, and that's why we're speaking out.
All right, and we're seeing some visuals right now of a rally that you held last summer, making sure that the province heard your concerns about potentially ending the program. And now that it is being ended, can you give us a little picture of what may happen? Because I think a lot of people who are insured and covered under OHIP right now who may be listening think that if you are not insured, then you are not supposed to be accessing these services. But what will happen now that it's ending?
Well, I think I can answer this in two ways. The first way is that people will suffer. Children will be turned away for when they have life-threatening injuries. What will happen is we'll see women in labor who will be asked for cash while they're delivering babies or after. We'll see elderly folks who don't present with heart attacks or strokes to hospital, and people who won't get their life-saving cancer surgeries, for example. This is all of what we saw pre-2020, and that's why this policy was so important. But what we'll also see is that people won't get timely upstream care when they need it, so they'll just get sicker, and then they'll end up in our ERs and hospitals downstream, which will ultimately cost our system more. So this policy, in stopping these cuts is not just the right thing to do, but it's a logical thing to do as well.
And as a doctor, you've seen it, as you said, pre-pandemic and during the pandemic as well. What impacts have you personally witnessed? Have you seen stories of people who have come in, whether they're a migrant worker, an undocumented worker, international student who may not have the coverage, who versus it was more comfortable, of course, coming in during the pandemic when this program was up and running?
For sure. I've seen lots of cases and situations where people have really benefited from this policy. I remember a woman who was fleeing war and persecution and came to Canada with her children. And when she got here, had started with a job, was diagnosed with a really late stage cancer. And because of this policy, she was able to get her cancer treatment, support, and care. She was able to work, care for her children, and flourish despite these tragic circumstances. In another instance, an undocumented man presented to the hospital with a bowel obstruction and literally told me the only reason I came to the hospital was because I know this healthcare will be covered and you guys will treat me well and like a human being. Imagine what would have happened if he didn't present to the hospital. He would have withered away and died. And this is the raw reality of what we're seeing. These are just a couple cases. There are many, many more cases like this, and these are the reasons why the Healthcare for All Coalition is holding this rally today and speaking out.
And a lot of people who are delaying the care that they need because when they go into hospital, they're in fear of being approached and asked about their status, maybe being deported, and so on. So these are some of the reasons and the fears behind wanting to go into hospital when typically any one of us would just walk in and feel comfortable getting that service. So what is going to be happening then later today? There is an event today. You are not just letting it go as it's supposed to on tomorrow.
For sure. We're standing up and speaking out today at Queen's Park. A rally will be held at 12 p.m. We invite everyone to come by. Bring your signs, bring your energy as we tell the government to stop these cuts to healthcare for uninsured people. I encourage people to check us out on Twitter and Instagram, Health for All Now. The hashtag is healthcare4all. We have a petition thousands of people have signed this petition. Check it out and sign it if you support this movement. And finally, call your MPP, email them, let them know that you care. I know that Ontarians care about their neighbors and we care about our communities. And I know that Ontarians will continue to show up for this marginalized community.
Are you optimistic that the province will hear you at this rally today?
You know what? They did the right thing in 2020 in implementing a policy that was centered around humanity and caring for our, people who are very vulnerable in our communities. We have to have optimism that they will hear us out and stop these cuts to uninsured health care.
All right, Dr. Naheed Dosani, thank you so much for joining us. Really do appreciate it, and we'll have all that information on our website as well.